Okay, I'm John Alila. John Alila is a clinical officer by profession. I coordinate TB activities in the Nyatike sub-county. I am privileged to be here. We are doing an annual performance review meeting for TB cross-border activities, something that we started like a year ago. Lucky to have two countries bordering us, that is Uganda and Tanzania. So we receive patients due to the nature of TB as a disease. We've seen patients seeking services from all over. We've seen Tanzanians and Ugandans reporting into our facilities. This is evidence to the fact that if you look at our TB registers, the records at facility level, if we are seeing patients coming all the way from Uganda to seek services here. So, you know, TB is a chronic disease that takes a longer period to treat, with the list going for 6 months and some going even up to more than 1 year. So these are patients that needs that follow-up because they have to come to the facility on a weekly basis. But sometimes back we noted numbers getting lost to follow-up due to the fact that they're disappearing a long way during treatment, because we know that some of them are Tanzanians and they're going back to seek familial support back at home. But now that if they go the other side, it's difficult for us as medics in this other side of Kenya to do follow-up or cross over at the other side. So they end up getting lost follow-up. Some come back with complications. Some even die because at the end of the day, the treatment interrupted and now the complications of TB do rise in. So with this forum, we are meeting with people from Tanzania to come up with modalities on how to enable patients to continue with care, even when they are on the other side of the country. Even if some come to this other part of the country, they are supported until they complete the full therapy of TB medication.
We have mostly barriers come up when it comes to now tracing these patients. You find that you have identified a patient today, and going to the other side, probably network-related issues. You want to make a phone call to locate this particular patient. Either network is roaming or the number that the patient gave you was a wrong contact. So again, it is coming out from the meeting that apart from the communication barriers, there are also barriers previously that were identified as probably maybe somebody going the other side and the authorities do not allow them to move freely. So again, that is an issue that has brought us on board to just find a comprehensive conclusion to it. Because in a number of occasions, we have seen some of our healthcare promoters or those who are doing tracing have been harassed on the other side. But remember, if we work together as the two countries at the border point, this will be a matter of the past.
Do you have maybe any recommendation that you think can be put in place so that the process be smooth?
Probably the only recommendation that I may put across, or we as a team here may put across, is to realign the communication and the barriers that already exist, to do away with the barriers, and to work together and closely with the authorities in place to make sure that our clients or our staffs on this other side are allowed to do tracing on the other side, and the vice versa. So even teams from the other side can follow up their patients here without any barriers. Yeah.
Kuna challenges ambavyo waka tuna face crossing border, cause kuna wenzetu ambao wako upande wa Tanzania. Kwa mfano tumepata mgonjwa kutoka Tanzania, akiingia hapa kwetu anaingia vizuri, anapata dawa. Meanwhile, wakati kidogo anaweza default ile dawa atoke aingie nchi jirani ambayo Tanzania. Ukijaribu kwenda kumtafuta ili kumuongelesha ili aweze kurudia matibabu, kwa sababu wakati ambapo ameacha dawa muda mfupi tu anaweza akafa. Wale wenzetu kuna Kiswahili wanakuambia kwamba ni nani uliambia mwenyekiti, uliambia nani ukaja hapa, unajua mpaka. Sasa hilo jambo waga linatuhuzunisha. Lakini kwa vile ambavyo tuliona wamekuja kati ya watu wa Tanzania na Kenya kukaa kama kuweka hili jambo ili liweze kujulikana kwamba ni watu husaidiana pande zote, tumeona ni vizuri. Hata wenzetu wameanza kuregeza angalau hata mambo yale ambayo wanayo magumu wameanza kuyaregeza. Na tulikuwa tunaomba serikali zote mbili, Kenya na Tanzania, tushirikiane kwa pamoja ili tuweze kusaidia watu wetu, kwa sababu hili janga huaga linaua. TB ni mbaya na TB inaangamiza na TB inaua. Wakati